Whether you play sports now or were active when you were younger, sports injuries are one of the leading causes of joint replacement surgery. According to the National Institutes of Health, there are two kinds of sports injuries, acute and chronic. Acute injuries occur suddenly when playing or exercising. Chronic injuries happen after you play a sport or exercise for a long time. A few signs of an acute injury include sudden severe pain, swelling, not being able to move a joint as normal, extreme leg and arm weakness. A few signs of chronic injury include pain when you play, pain when you exercise, a dull ache when you rest, and swelling. The specialists at Florida Hospital Waterman's Joint Replacement Center explained the different treatment options they offer to those suffering from acute or chronic injuries.
Anytime you're training for athletics, it's important to follow the advice of your trainer and make sure that you warm up appropriately and stretch out before. We see a lot of injuries just because athletes or young athletes don't do those simple things, and ice after a game or after a tryout is also real important to decrease the inflammation.
We see a lot of sports injuries. We have an older population and they're very active, so we have people that play softball, pickleball, basketball, tennis, and usually when we're doing surgeries or when I do surgeries, I'm trying to get them back to whatever they were doing, whatever that may be.
I do a lot of shoulders. We could get into a lot of detail about shoulders, but in general, I'll tell you a little bit about a reverse shoulder arthroplasty, which is a relatively newer technique, and this procedure has really revolutionized the way patients can start using their arm again. And basically what it does is it reverses the anatomy of the shoulder. The socket goes on the arm side and the ball goes on the socket side. And what it does is it stretches the deltoid muscle, which is the muscle on top here, to enable you to move your arm again.
Our goal is to try to get them back to golf or any of the other activities that I mentioned as soon as possible. And a lot of people tend to think that, oh, I'm having a knee or hip replacement, it's the beginning of the end. And I think we've done a lot to try to reverse that, because most of the patients, even the golfers, get back to playing golf within 6 weeks after the procedure, sometimes less than that. The best thing you can do is maintain an active lifestyle. Most of the injuries that I see in patients over 35 are from people who have reduced level of activity and start trying to be very, very active without slowly working their way into it. That is by far the most common problem that we see.
You can learn more about the joint replacement services offered at Florida Hospital Waterman when you click the Sports Injury Story Link icon online at yourhometownhealth.com.